Welcome to the Healthy Body. Dr. Alex here. Today, we're diving into one of the most intriguing, misunderstood, and surprisingly common aspects of intimate pleasure, female ejaculation, also known as squirting. If you've ever wondered what it really is, how it happens, and most importantly, how to help a partner experience it in a safe, consensual, and deeply pleasurable way, you're in the right place. By the end of this conversation, you'll not only understand the science behind squirting, but you'll also have a clear, step-by-step approach for creating the right conditions for it to happen, without pressure, without guesswork, and without turning it into a performance. And if you enjoy learning practical, science-backed tips for improving your health, energy, and intimate well-being, make sure you subscribe to the Healthy Body right now, so you never miss a future video. Now let's begin with the big question. What is squirting really? Despite what you might hear in pop culture, squirting is not a mysterious superpower reserved for a lucky few. In fact, research shows that it's a natural bodily response in many women and people with vulvas, though not everyone experiences it in the same way. Squirting is essentially the expulsion of fluid from the urethra during intense sexual arousal or orgasm. This can be a small amount, a large amount, or somewhere in between. The key is that it's not simply urination, though it does involve the same anatomical area. We'll talk more about why it can feel like you have to pee in a moment. Think of it this way. During arousal, the body's sexual organs become engorged with blood, just like a balloon slowly filling with water. The tissues swell, sensitivity increases, and nerve pathways light up. Squirting happens when certain areas, particularly the internal portion of the clitoris and the tissue known as the G-spot, are stimulated in a way that triggers a release of that stored-up fluid through the urethra. Understanding the plateau phase. To get to this point, the person must first reach what's called the plateau phase of arousal. This is the stage just before orgasm, when sensations are intense but not yet at their peak. Think of it as the top of a roller coaster. You're right there, about to drop. If your partner has already experienced one orgasm, you might think the session is over. But in the case of squirting, the magic often happens when you keep going, with enthusiastic consent, of course. Instead of stopping, you maintain stimulation in a way that encourages relaxation and deeper arousal. This is important because many people instinctively tense their bodies during orgasm. That tightening can block the release needed for squirting. Here's where breathing plays a huge role. Encourage your partner to take slow, deep breaths, in through the nose, out through the mouth. This keeps the pelvic floor relaxed and helps bypass the instinct to clench. Practical setup for comfort. Now, let's talk about logistics. Squirting can be messy. This is perfectly natural, but it's worth planning for so you both stay comfortable. Have a clean towel or a waterproof sex blanket ready. These have one side that's absorbent and another that's waterproof to protect your bedding. Trust me, this small preparation can make the experience far more enjoyable, because no one wants to lie in a wet patch afterward. And while it might feel a little clinical at first, it's actually a sign of thoughtfulness and care. Many couples I've worked with make this part of their ritual. The technique. Once your partner is deeply aroused, or ideally after they've already had an orgasm, you can begin the internal stimulation that often leads to squirting. Start with clean, trimmed nails. This is non-negotiable. Then, with lubrication if needed, insert one finger into the vagina with your palm facing upward. Your goal is to make contact with the front wall of the vagina, about 1 to 2 inches inside. Externally, with your other hand or thumb, stimulate the clitoral glands, the visible part of the clitoris above the vaginal opening. By combining internal and external stimulation, you're engaging both the external clitoris and the internal network of erectile tissue that surrounds the vaginal canal. Imagine pressing your hands together from both sides, internally and externally, creating a firm but pleasurable pressure on the clitoral structure. From here, you can experiment with the famous "come here" motion, gently curling your finger toward your palm. For some, a more direct in and out motion feels better. Anatomy varies, so pay attention to feedback. And here's a key detail. Ask for a number. For example, if 10 is too much and 1 is too light, what number is this? That way, you can calibrate exactly to your partner's body and preferences. Remember, squirting isn't about forcing an outcome. It's about following the body's cues, applying consistent pressure, and staying connected through communication. That I have to pee sensation. Many people report feeling like they need to urinate just before squirting. This is completely normal. Here's why. When the internal clitoris becomes fully engorged, it presses against the bladder and pelvic floor muscles, creating a sensation similar to needing to pee. Encourage your partner to empty their bladder before you start. Then, when that urge arises again during play, reassure them that it's a sign they're close to ejaculation. Consistency here is key. Keep the same pace, speed, and pressure unless they specifically ask for a change. Sudden shifts can interrupt the buildup. The moment of release. When squirting happens, it can be a sudden gush, a rhythmic pulsing, or even a light trickle. Afterwards, the receiver may feel an intense release, followed by a moment of sensitivity or even an instinct to move away quickly. Don't take this personally. The body sometimes reacts involuntarily after a powerful orgasmic event. Give space, offer reassurance, and let them know this is a safe experience to explore together. Final thoughts on practice. Like any intimate skill, learning to help a partner squirt takes practice. It's about more than technique. It's about building trust, reading body language, and creating an environment where exploration feels exciting rather than pressured. Think of it as a shared journey. Each attempt is an opportunity to understand your partner's unique responses. Even if squirting doesn't happen every time, or at all, the process itself can bring you closer and open up new levels of pleasure. By the way, if you're finding this helpful, remember to subscribe to The Healthy Body so you won't miss our upcoming videos on sexual health, energy, and whole body wellness. If today's video gave you insights, techniques, or even just a fresh perspective, hit subscribe now and join our community. We share trusted, science-backed ways to improve not just your intimate health, but your overall vitality and well-being.